12 non-hormonal birth control options. Non-hormonal birth control options focus on preventing pregnancy without affecting a woman's hormones. These options are great because unlike hormonal birth control, they do not raise the chances of getting breast cancer, blood clots, gaining weight, or having mood swings. Some non-hormonal birth control options provide protection against sexually transmitted diseases. These options fall into 3 categories, and they are barrier, surgical, and behavioral methods. In this video, you will learn 12 non-hormonal birth control options that can be used if a woman does not want to become pregnant and has concerns about using hormonal birth control. We will also tell you which type of method each option falls under. Before we proceed, please subscribe to our channel and help us establish our presence on YouTube. Here are the non-hormonal birth control options. 1. A tubal ligation. A sterilization surgery called tubal ligation is an extremely reliable way to prevent a woman from becoming pregnant. When this surgery is performed, they block the fallopian tubes, which prevent an egg from reaching the uterus. A tubal ligation can increase the risk of an ectopic pregnancy, which is where a fertilized egg implants in the fallopian tubes. An ectopic pregnancy is dangerous and usually turns into an emergency room visit. In the 70s and 80s, doctors did not always cauterize a large enough area in time, and tubes grow back together. If a woman is younger, when she has a tubal ligation, her chances of becoming pregnant are increased, mainly because there is more time for her tubes to reconnect. Although this procedure is highly effective, 1 out of every 200 women may become pregnant after a tubal ligation. This procedure is considered permanent birth control. However, it may be reversed, and approximately 50 to 80% of women become pregnant after the reversal. These pregnancies may not always be viable.
This video is partially sponsored by DelvixGarden.com, your source for high-quality food supplements and personal care products at low prices. This company has a range of premium products for your health, beauty, and personal care, including organic pine pollen, ceremonial-grade matcha, medicinal herbs, hair dye shampoo, and plant-based protein for weight loss. There are links in the description. Kindly visit their store and use the coupon code FIRST20% to get 20% discount on your first order.
2. Vasectomy. A vasectomy is another sterilization surgery that is performed on men to prevent pregnancy. This procedure is done to block the sperm from reaching the semen that is ejaculated from the penis. It is considered a permanent contraceptive and is 99.99% effective, and only 1 in every 2,000 cases fail. This surgery can be reversed, and if the vasectomy was performed less than 10 years ago, there's a 95% or higher chance of impregnating a woman. Each year that they wait to get the reversal reduces the chances of having a child. A natural reversal called recanalization, 2 severed ends rejoin, happen when the duct which transports sperm from the testicles to the urethra creates a new connection. This normally happens within 12 weeks of the vasectomy, but can happen years later and go undetected. 3. A diaphragm. A diaphragm is a barrier method that is used to block semen from entering a woman's womb. It is a saucer-shaped silicone cup that is put directly into the vagina. This method requires a doctor's visit in order to be fitted for your device. If you use a diaphragm correctly and add spermicide, you only have a 6% chance of becoming pregnant after a year's use. A diaphragm can be properly placed right before you have sex. It is reusable for 12 months. A diaphragm will not protect you from sexually transmitted diseases, and you need to have it in for at least 8 hours after sex. Some people contract vaginal and urinary tract infections more often when they use this device. 4. Cervical cap. This barrier method gets its name because it looks like a hat-shaped piece of silicone that is placed over the cervix to keep out sperm. A cervical cap must be fitted by a doctor and should be used with spermicide. Using this type of method has a failure rate of 20%, meaning 20 out of every 100 women that use it will get pregnant each year. The cervical cap can be left in place up to 48 hours after having sex. This method can raise your chances of contracting bladder infections, and it will not protect you against sexually transmitted diseases. It is not recommended for people that have sex at least 3 times a week or have a history of pelvic disease. 5. Sponge. The sponge works the same as the diaphragm or cervical cap. The difference is you can buy it without a prescription and it already contains spermicide. This barrier method is one of the least reliable forms of birth control for some people and prevents pregnancy about 91% of the time for women who have never given birth and use it correctly and consistently. If a woman has had children, it only prevents pregnancy about 76% of the time. The material of the foam is a polyurethane foam that feels similar to the vaginal tissue. When using the sponge, you can have sex multiple times within a 24-hour period. Unfortunately, just like the cervical cap and the diaphragm, the sponge will not protect you against sexually transmitted diseases. 6. Copper IUD. The copper IUD is an intrauterine device that is a T-shaped plastic piece wrapped in copper, which is toxic to sperm and keeps it from swimming through the vagina to reach the eggs. It prevents fertilized eggs from attaching to the womb and is one of the best working forms of barrier birth control. The copper IUD is effective 99% of the time. You can leave it in for 10 years and it works as an emergency contraceptive up to 5 days after you've had unprotected sex. The copper IUD has to be removed by a doctor. Some women experience cramps or bleeding between periods. 7. Vaginal gel spermicide. Vaginal gel and spermicides are chemicals that are inserted into the vagina to paralyze or kill the sperm. In most cases, an applicator is used to insert the spermicide. There are 2 ways that the vaginal gel creates a barrier to prevent pregnancy. One is it blocks the entrance to the cervix so the sperm cannot enter, and it also stops the sperm from moving well enough to swim to the egg. You can buy them over the counter in several forms such as suppositories, foams, and gels. When used alone, spermicides fail 28% of the time. You should use spermicides with diaphragms, condoms, and other contraceptives to increase the effectiveness of spermicides. You should not rinse out your vagina for at least 8 hours after using a spermicide. Spermicides do not protect you from sexually transmitted diseases, and some people may be allergic to these chemicals. 8. Male condom. The male condom is often made of latex and is a sheath that's very thin that the man wears over his penis to keep semen from getting into the woman's body during sex. It is about 82% effective at preventing pregnancy. They are easy to find online at stores and even gas stations. You do not need a prescription for condoms, but it is important to follow the instructions carefully in order for them to be effective. The male condom not only guards against unplanned pregnancy, but provides protection against sexually transmitted diseases. 9. Female condom. The female condom is a lubricated latex tube with flexible rings on both ends that is placed inside of the vagina in order to form a barrier to keep out sperm. This is not a very effective way to prevent pregnancy, as 1 in 5 women who use female condoms get pregnant. However, they do protect you against sexually transmitted diseases. It is important to use them every time you have sex and in the correct way in order for them to be effective. 10. Natural family planning rhythm method. Natural family planning is a behavioral method which involves a woman tracking information so she knows which day she is fertile and should skip or use a barrier method on those days. Today, most people call this fertility awareness. However, for centuries, it's been known as the rhythm method. A woman tracks her menstrual cycle, her vaginal discharge, and body temperature, which helps her predict when she's ovulating. Out of every 100 women who use this method, up to 23 of them will become pregnant. Natural family planning is best for women who have regular cycles and are dedicated to keeping good records and monitoring their bodies. 11. Outer course. Outer course is a behavioral method when a man does not put his penis inside a woman's vagina at all. It's similar to foreplay. There's no risk of pregnancy when practicing outer course unless the man gets his penis a little too close and has fast swimmers. Outer course has a very low risk of contracting STDs because there is no penetration. 12. Withdrawal pull-out. Most people have tried the withdrawal pull-out method at some point in their lives and hopefully it worked. This is exactly what it sounds like. The man pulls his penis out of a woman's vagina before he ejaculates. This method is not very effective and about 22 out of 100 women will become pregnant using this method. Thank you for staying with us until the end. If you have not done so already, please subscribe to our channel to help us establish our presence on YouTube. Remember to click the bell icon for notifications of new uploads.